this is a very important event for our region because we're very lucky to have 3 amazing partners co-sponsoring this conference. We have the Addiction TTC Mental Health Technology Transfer Center and the PTTC, which is the Prevention Technology Transfer Center. So the 3 of us collaborate very closely to advance the prevention, addiction, and mental health care in our region. So without further ado, let me turn it over to opening remarks for Rachel Brase, the Regional Behavioral Health Advisor of Substance Abuse of Mental Health Services Administration. Thank you.
Thank you so much for the introduction, Maria. Again, my name is Rachel Brase. I am working with the Substance Abuse Mental Health Services Administration. I'm the Regional Behavioral Health Advisor for Region 1, which means if you're in the New England area, that you can always reach out to the SAMHSA office, and I'm one of the people who will be answering. So before I get into it, I want to give a brief overview of SAMHSA. So SAMHSA actually has 10 regional offices. So depending on where you are in the country, say if you move away from our New England area, which in the winter, I can't blame you, and you move down to say sunny Florida, that there will be another regional behavioral health advisor, regional director that you would be interacting with. But that is to say that no matter where you go, if you are reaching out to SAMHSA, there will be someone more local in the area that will be reaching back out to you. So you can always feel free to contact any of us. And you can find out who's in your region by looking at the SAMHSA website. Additionally, in order to do some level setting, the first thing I wanted to highlight is that according to the NSDA survey sent out by SAMHSA every year, 54.4 million adults either have a substance use disorder or a serious mental illness, which is to say it's far more likely to encounter someone who has substance use disorder or a serious mental illness than it is someone who doesn't have either. So in that note, it's vitally important the work that we do because the people that we are going to interact with, most of them are going to be people that we directly serve. So some SAMHSA highlights I wanted to highlight is that from our recent NSDA survey, we realized that recovery is very common. Approximately 7 in 10 of people who have a mental health or substance use condition are in recovery, which means 20.9 million people with substance use conditions are in recovery, which makes it approximately 72.2%, as well as 38.8 million people with mental health conditions have signified they're in recovery, which is about 66.5%. So really see that recovery is very common. And this is through, in no small part, to all the excellent work that not only our TTCs have been doing, but also the work that our participants in this conference have been doing themselves. So I want to give a great shout out to everybody. Also want to highlight that when it comes to SAMHSA, we've released a couple new and very informative resources that are available for free on the SAMHSA website. The first is that the 2024 National Strategy for Suicide Prevention has just been released. You can find that on the SAMHSA publications, and that is for free and completely available, easily accessible to the public. The other event that I wanted to highlight is the Art of Recovery. So its goal is to promote artistic avenues as viable tools for coping, self-discovery, and expression. This project aspires to break down societal stigma surrounding mental health conditions and substance use while fostering understanding and support for those whose journey is for wellness. So we at SAMHSA are accepting any sort of art as a submission until June 28th of 2024. The prizes are that 150 youth winners and 3 adult winners will be displayed in an online exhibition, and 15 additional submissions will also show an in-person gallery in headquarters and around Washington, D.C., starting in September of 2024. So if you are at all interested in this, please check it out on the SAMHSA website, and please feel free to submit your art or the artwork of other people you feel like signifies your journey through recovery. And with that being said, I wanted to give once more a big thank you and a big welcome to everyone attending this conference. If you ever have any questions related to SAMHSA or you need additional support, please do not hesitate to reach out to me. I will pop my email in the chat, but overall, I wanted to say a big congratulations, a big welcome, and a big thank you to all our TTCs for helping create this wonderful, amazing conference. Thank you all so much.
Thank you so much, Rachel. And what we are so lucky. We not only have Rachel in our region, but we also have a new behavioral health, another health advisor. So thank you so much for that. And I think we want everybody to really use all the amazing resources sponsored by us. So it's now my honor and privilege. So because today's theme is really about health equity, we couldn't be in better company than my friend, mentor, and colleague, Dr. Dietra Hawkins. I have the honor and pleasure to be working with her for a few years now. I'm going to let her introduce herself. I know she likes to do that, but I have to say that she talks about healing. And this conference is about healing. I love, Rachel, hearing you talk about recovery. We're all about healing, recovery, and thinking about these issues from that appreciative inquiry lens. So you're here for a treat. And it is now my honor and pleasure to present you to Dr. Dietra Hawkins. She is the founder and CEO of Both and Partners. Dr. Dietra, welcome to the TTCs in Region 1.
Thank you so much. I'm so excited to be here. I believe that it's important that we are always finding ways to show up. And one of the benefits of the pandemic is that most of us are now comfortable with Zoom. And so, so happy to see everyone here. I think I'm going to be able to have permission to share my slides or be able to advance. So do I need to ask permission for that somewhere, or?
You
are good to go, Dr. Dietra.
I should be what?
You should be able to control. I gave you slide control.
Okay, let's see. So if I'm clicking, is it letting me click along? Uh-oh.
I can keep it moving for you if that's all right, if that works.
Yeah, if it doesn't seem like I'm moving them along at this point, but that is perfectly fine. So we will be able to go from here. So to start off with, everyone, I am very interested in supporting everyone and recognizing their role as being a leader. So although I'm talking about leading change, I don't want you to think that, oh, I have to have an official title to be in that role. So we'll go to the next slide. I am Dr. Dietra Hawkins, and I thank you, Maria, so much for giving me an opportunity to sort of introduce myself. One of the things I often like to start off with is that I think of myself primarily as a facilitator over a trainer. And I emphasize that because I'm very interested in helping people be able to change what they do and not just change how they think. And that not that training doesn't do that, but often the way that our brains like interpret training is that it's just about the delivery of information. And what I have found in our systems work over the years is that it's really important that we do more than just that, that we create opportunities for people to eat together, to share music together, to be part of creating art together. And so there's a skill in terms of facilitation that recognizes that we have to be able to create what we call a brave space and not just a safe space for everyone to have an opportunity to contribute and participate. I'm also a researcher, and I really believe that we cannot have good quantitative research without qualitative research. And so part of that is really serving in the intersection of that. And I think of myself primarily as an advocate for and an ally to recovery, also a family member. But one of the reasons that I talk about this is I hope that everyone can start to identify as an ally for recovery, as an ally for all of these issues, because there is no movement. This is about a movement. There's no movement that is successful without its allies. So we need to be aware of how we can bring that mindset more into the work that we do. And so I also need to acknowledge that I am trained as a clinical psychologist. And so often I have to apologize for my field, right? And I'm glad that we have been doing that more and recognizing the role that psychology has played historically that has, created harm. So I recognize and have learned over the years that many of the things I was taught to do, especially culturally, actually don't work very well. And so I try to unlearn that. So I think it's important that I acknowledge that part and acknowledge that we're in a different space than we were 20 years ago when I was first in the field, which is why I talk about being a mom, being a wife, growing up in the South as a Black Catholic, because these parts are important to my identity. And I think it's important that we practice that transparency and also to try and help other people bring other parts of themselves into the room instead of keeping those things separate. I do use the pronouns she and her. And I already see someone talking about intersectionality. Yes, right? Because there are so many pieces of who we are that are intersectional. And without us bringing that into the room, it's hard for others to know that it is a space that they can also bring that into their to the room. Okay, we'll go to the next one. So first, just thank you. Thank you for the invitation. Thank you for everyone who has actually shown up here. I'm curious if you all know how to use these emojis here, but I want to give us all a clap, like we're here. Thank you. So can people do that? Let's do that. Okay, we're going to give some snaps. We're going to give a clap. We're going to say yes. So I'm happy to see that. We also have to okay, this is great. I can see it now. So I need that. And we all need that. We need to know we're here together, that we're connected, and that we can use our technology for that. My goal today is for us to really understand the importance of being grounded in our why. And that it's really sort of the first step is learning to tell that story. The next piece is finding openings in your champions and seeking a win-win. And what I'm going to be doing is pulling apart some work from John Carter and how I interpret that from a cultural intelligence lens as we think about, we have these institutions. And one of the things that I think happens is sometimes we ask institutions to do things that only communities can do. But there are things that institutions can do, and we can help institutionalize those learnings into the institutions so that when we're gone, right, or we get promoted, which many of us do, that there's still the work that we've done, our legacy, that the movement continues. But we have to keep that in mind as we are doing the work. Okay, so we'll go to the next slide. So one of the ways that I do this is I always start by sharing the basic tenets. So these are basic tenets that have evolved and grown over the years. And I'll go through them with you and try and add a little context. So the first is that everything we do exists in a social, emotional, cultural context. So us showing up in these little boxes is contextual, the way that we are here today in our current political climate, there's a social emotional piece. I'm thinking about Mother's Day and how for many of us it's a somewhat painful, that it's not always that celebration, but there is a way to bring that in. And so there's a context to all of that. And so just being aware, right? Like, are we aware of that? That one of the things that we talk about is that all of this work is about being on a journey together, that we are not trying to necessarily arrive. And so if I can pull that apart just a bit, there's a way sometimes in which there's this idea that the end justifies the means. And I think in our work in particular, from a health equity perspective, from a recovery perspective, what we are saying is that how we get there is important. That how we traveled together, how we treated each other, how we've had conversations is important. And so I just want you to know, I believe that. Like, I think that is really critical, and that there isn't really a way in which we, oh, as long as the end is great, you know. So I think that's important. To that point, we need to be aware of our own filters. So there's that statement, never get it quite right, where we don't see the world as it is, we see the world as we are, which I think is important that we pay attention to other people as well. Like, you know, I can see something one way, and that's going to be influenced by my experiences. What I like to tell people is that filters can be taken off and cleaned. Okay, those filters are there to help us, and they, you know, filter the bad stuff out. And sometimes they get a little clogged. I know I've been doing this recently, unclogging some filters in the dishwasher. Who knew that existed? And that, you know, this is part of the work. This is part of what we need to do. The other piece with that is that the work is messy and toes will be trampled. And what I always say with that is that we are not going to agree to disagree when harm is happening. So if you are on my toe, I'm going to say ouch, and you're going to get off my toe. And so as we do this, I think it's important that we're able to recognize that the work is going to be messy. And so sometimes we do this work and people think, okay, tell me everything I should never, ever do. And the thing is, like, we're human. We're going to make some mistakes. And if we're having fun, like when you dance, sometimes you step on a toe. And the goal is to be able to be responsive and not necessarily reactive and mad at somebody when they tell you ouch. Okay, we'll go to the next one. So I like this little image because I think that we're always in a process, and that as we are working to be more competent, what I want us to pay attention to are the two words here: humble and active. So many people will be familiar with cultural humility, right? And what I want us to be thinking about also is how we can actively seek information and just always be continuous learners. We'll go to the next one. Oops, one more. Yeah, here we are. So I do not try to show up with cookbook approaches. I think it's important that we can have some perspectives, you know, and give some ideas. So I'm just going to share like one strategy for how we can lead change. This is not the only strategy, it's just one. Also with that, you know, stereotyping is something that our brains do to conserve energy. What we want to be able to do is help our brains be more diverse in its stereotyping ability. Okay, so there's ways to do that. I won't be able to talk about it today. Follow me in some other spaces. We unpack that a little bit more. Great information out there that you can read up on, and I'm happy to give resources to that. So I do believe in the work that we all have a role to play, and this last one is probably the most important, that I am not here. The work that I do is not meant to create blame and shame. Our blame and shame culture actually allows the status quo to continue because we get caught up in trying to say who's the wrong person. It's also the way in which many of us with intersectional identities that have been marginalized can sometimes be pitted against each other. So what I want us to know is that we're in this soup together, right? And we need to find ways, which is how and why I use an appreciative approach, to talk about the things that help us and move forward on those, instead of taking the time to figure out what the issues are that are to blame. It does not mean that we don't point out what the problems are. It just means that we don't focus solely on establishing that blame. And if you feel that you are, we also don't want anybody to take it on. You know, some people leave here and just take on this sense of blame. And often what that does is it sort of immobilizes us. Okay, we'll go to the next one. Next slide. So today I thought it would be important that I talk about what does a culturally competent, recovery-focused, wellness, health-focused organization do. Okay, put all those different things in there because it's something that's going to evolve over time. One of the first things it's going to do is actually value diversity. right? It's going to recognize the importance of that. And it's going to make sure in all its processes that it's thinking about diversity and actively centering it. The second is that it's going to conduct some regular self-assessments. That means that it is going to incorporate that into your regular meetings if you do supervision. If you part of an organization and you're in a leadership role, that means that you're going to have like these questions embedded every year, ideally even quarterly. So it should be pieces that are in all the time. We're looking for vision statements that clearly establish that this is important. We're recognizing that those organizations are able to manage, welcome, work with the dynamics of difference. So an example of that is that microaggressions happen, and we can incorporate micro interventions and micro affirmations, for example. Instead of just focusing on the things that are the problem, we focus on the ways in which we can support people. I'm not talking about micro affirmations today, but I did want to mention it. Institutionalizing the cultural knowledge. So an organization often has like official policies and unofficial policies. And so we have to be mindful of how we are institutionalizing knowledge. And that might be in the form of a video, that might be in the physical structure of an organization. Oftentimes it could even be in the structure in which you hold your meetings, right? If you value people being well, do you start your sessions and your meetings where you're doing a bit of centering, right? How are you incorporating in that institutional knowledge around wellness? That would be something that would be incorporated into the day-to-day, and that doesn't get left out when things get hard. Okay. And then the last is actually somehow there's a word missing here, but it should say that it adapts to diversity. And so as we think about how to move forward and what organizations do, that's one of the things that we pay attention to. So I like to share this particular piece. This is great, which is to talk about the importance of dialogue and the role of debate. Okay. And so when most of our work, we're trying to move in the direction of a shared purpose. That's kind of what recovery and wellness, equity help us do. And we're often in the space of serving and learning. We're not necessarily in the space of trying to win, right? And sometimes we can find ourselves trying to convince people of things, but when I think about recovery is with the person, right? And so I don't know about you, but it doesn't help to debate those things. So what we want to do is help people be in a space of dialogue. And so I always bring that up and make sure that we highlight that what I'm suggesting is the skills around dialogue, finding ways to learn to understand and share, and that the thing that's in the middle is the discussion, okay? And a strategy with this is that when you find someone who's trying to convince or win with you, can say, wow, it feels like we're in a debate at this moment, okay? Just state that. And, if it's a debate, then you know what you're trying to do. But if it's a dialogue and you can invite them into a dialogue, then that helps you move in a different direction. We'll go to the next slide. Okay, so I've been talking for a moment. What I would love to hear in the chat, what are you curious to learn about? What have I maybe said already? What has intrigued you? What are you most curious to hear about? Already, and just taking a moment to look through some of this is very cool. So I know that we get to share slides. It looks like a lot of comments here. I love that. But what are you most curious to hear about? Oh, very good. Okay. I love that. Yeah, brave space, microaffirmations. Okay. Awareness, how to be more inclusive. Yes, definitely. Let's see. Okay, addressing health disparities. That's so important. While recognizing the fatigue, yes. Inclusivity. Awesome. Microaffirmations. Okay. Well, I'll try to pull a few pieces in, which is great, on what I often talk about, and can in other spaces actually do a whole piece on microaffirmations and where some of that comes in as I see that, but also I think just these ideas. So what I want to do is it's always helpful to know what people are curious about. And what I like to think about, yes, I was going to say, you've got like a whole range of things that are going to be presented over the next couple of days. So I hope you all continue to show up and ask those questions, and then also start to see the integration of these things as as we're going along. Awesome. Okay, so we'll go to the next slide. So I started off with stories because I think that, like in giving my basic tenets, like that information before presenting data. Because when we think about it, stories actually help people more than data does. However, there's great data out there. And one of the things that we can see is that, companies recognize that they do better, when there's diversity. We'll go to the next one. And when we think about, what do we even mean by culture? It's helpful that we have a more dynamic and diverse, what I would call a much more inclusive definition of culture. I don't know if I have anyone here who might be able to come off mute and would be willing to read this definition for us. You could raise your hand. Martha, oh, did I see a Martha raise a hand or just came in? Whoops. Who wants to help me read this?
I can help you, Dietra. This is Janice.
Oh, thank you, Janice. It's just
Sure.
nice to have another voice in there.
Culture, defined as the integrated pattern of thoughts, communications, actions, customs, beliefs, values, and institutions associated wholly or partially with racial, ethnic, or linguistic groups, as well as with religious, spiritual, biological, geographical, or sociological characteristics. Culture is dynamic in nature, and individuals may identify with multiple cultures over the course of their lifetimes.
So this is a definition that comes from the original class standards, which have been updated over time. But I always share this because of the last sentence, which is that people are going to identify with multiple cultures over the course of your lifetime, that it's not something that like is set, and that as we, I don't know if any of you have, children, or there's a period and when they're little, that's one part of your life. There's a whole nother when they launch and then they're back, right? So it's just things change over time. And I'm currently identifying with the different ways in which I can see, and that has evolved over time, just as a personal piece. But then I think a lot of us, especially for me.
I can do it.
I could, oh, okay.
Cultural intelligence refers to the skill to relate and work effectively in culturally diverse situations. An individual possessing cultural intelligence is not just aware of different cultures, They are able to culturally adapt and effectively work and relate with people across a variety of cultural contexts.
Thank you. So I think it's helpful that we start talking about cultural intelligence, and well, not start, well, that we return to talking about it as a term. It's really interesting to go back and see the historical nature. Like we've had these terms around for over 50 years, right? But they sort of come in and out. And also there's a recognition of where these things can play. So just as we are working and thinking about being adaptive is really the key, right? And being aware across, so that, you know, that you're able to pivot, which is one of the things that I think is an important skill. Okay, we'll go to the next slide. So back to a little bit of data that I think is important, just to acknowledge that, you know, some work, especially out of Forbes most recently, and also with some Gallup research, is talking about that people of color, you know, are 50% more likely to report that they face discrimination. Right? We know that this is what we're having to pay attention to. And that when we think about, you know, staff of all races are more likely to recommend an organization that they see as diverse and equitable. And that when we pay attention to this, that really employers are recognizing that this is important. They might not be stating it as like, you know, as loudly. I think a lot of us can see it, right? I know I see it when I look at ads these days. There's just a recognition that we need to be doing this work. And so the other piece that I wanted to acknowledge, because people are always, you know, saying, oh, what's going on with our diversity, equity, inclusion work? When we talk with people, they are saying that they view this work as being important, especially you know, our current, like our newest generation entering the workforce. And so if we want to maintain our workforce and people, we need to be paying attention to this and really encouraging cultural intelligence. So as much as it might seem like, okay, it's all going away, I think what is, you know, really positive is also the federal mandate for addressing these issues. It's really being embedded. I recently had a chance to visit the CDC, the Center of Disease Control. And if you're not aware, racism was declared a public health crisis. Like it's embedded in that, like at that organization, in the work. They have a whole department for health equity. And there's some wonderful resource that is available on their website related to that. So I think it's important that we know that this is there. The research is there, has been there for a long time. It's always been there. How we talk about it might be different, but it is all part of the work that we do. Okay, so I like to do the next thing, which is to do a poll, find out who's here and what you're thinking about and how comfortable you are with some of these topics. So we can launch the poll. So first question, how do you see yourself? And it's multiple choice. And of course, if there's something else you want to add, you can put that in chat. Love that. An agent of change. Yes. Okay. A curiosity chaser. Love that. Okay, so we've got definitely an overwhelming number of people who are learners, and so you are in the right place, and that is so wonderful. So I'm excited that you're here. We'll do another poll question. Have you watched any of these? could be none of these. In chat, you can add what kinds of films you are currently watching. Or have in the past. How are we looking so far? Okay, so not too many, but we have a few, right? So definitely add in chat what some of the things, okay, wonderful. So part of what I like to, yay, the 13th. What I like to pay attention to, and as we do this work, is to ask people, what are the, where are they spending their time? What kinds of material are they consuming in terms of what they watch? How aware are we of stretching into other, other areas of the entertainment world? It's very helpful, I think, to find out, just ask questions related to that. Okay, next one.
And this one is a yes, no, sometimes.
Yep. I'm not sure how we see the
Yep.
yes.
So we
no.
have a lot of yeses for answer number or question number 1. I'll share that out. So we have also a lot of yeses for question number 2, then sometimes. And then question number 3 have a variety of sometimes and yeses.
Wonderful. So what I want to just highlight for you as you are leading change and working with other people, which is really important here, is that you are aware of questions you might want to ask other people that you're working with. How comfortable are they also in taking risks, taking leadership, paying attention to that? And then we'll be able to just be aware. So just some questions that can be helpful to be asking people, especially when we're thinking about issues around microaggressions and microinterventions, because there's often that tension. All right, we're going to go to the next slide. So how many people see an old woman in the picture? How many people see a young woman in the picture? You can add that in chat. What do you see? Okay, so far I see Mostly young, one person, a couple say both. Always young one first, right? Old both. Okay. Awesome. So one of the things to think about is that our brains kind of like closure, and they like to be able to make decisions about things. So we sort of have to be patient with ourselves. And so my point in us developing our cultural intelligence is the last piece of self-compassion, because we have this this easy move toward affinity bias to, the things that we're familiar with. That's going to be a default. And that there is such a thing. There's a great book and there's some great resources out there that talk about, thinking fast system 1 and thinking slow system 2. And that what is our automatic thinking, and that those just what comes to mind. And then where we can practice the pause, so that we can, maybe if we first see the young woman, that with the pause, we can actually also see the older woman. And that it's not a binary, that we have to be mad at ourselves if we only see one or the other, and how our brains work. That is part of what I hope, as we are working on developing our cultural intelligence, that one, we have self-compassion, and then we can also have self-compassion for other people. Okay, we'll go to the next one. So I've been mentioning this work by John Carter, and is really again, just one strategy for thinking about how we can lead change. And for those of you who are the curiosity struck, like all of those different pieces, how we can be in a space to be helping to disrupt the systems, our status quo. So from John Carter's perspective, this actually is not linear. And so even though it's presented in a linear way on this slide, it is not a linear process. And I think that's really important as we think about this work. And what I'm going to do is unpack a few of these from a lens of cultural intelligence. So we'll go to the next slide, which I like to start off by saying, instead of just talking about urgency, which I think many of us know that if you're always in a state of crisis, like that is unsustainable and it's unhealthy for your bodies. And so we can't constantly raise that sense of urgency. What we can do for sustainability is ask people and communities and organizations to talk about what do they really care about, to help them dream of what is true, good, and possible, to actually help us attend to, well, what is our best work? Even if it's not related to what we think we're supposed to be focused in on. So I like to think of this as the recovery transfer, those transforming, those other skills that you get in recovery. And that transferable skills, that's what it is. That's the word I was stretching for. And that all of this helps us to first just identify why. Why do we care? And so the strategy here that I often tell people and encourage you to do is that when you're in a position of leadership and someone asks you a question, find a way to keep digging and asking why at least 5 times. Actually, if you can get to 3, you're doing really well. Okay. And what we do here, what I've learned, as you can see in this little, hopefully you can see in this slide, is that when people first come to you asking what questions around the resources that you need, and what are we going to do, and what are the policies in the organization, that there's often a way in which we can spin and just move toward the what's. But if we are intentional, what we want to be able to do is be really clear about, why is this important? What is our purpose? What is it that is actually motivating us? And that this is something that gets stated by every single person. Like, it's not just the leader that talks about this, but it's also the rest of the staff. It's also going to be the people who participate in the service. And that when you get really centered on that, that helps you to be able to talk then about, well, how are we going to move forward, right? What are the strategies that actually help us here? What approaches should we be using? And how can our organization support us? I love this, yes. And it's amazing, right? I saw someone say, this is what my 7-year-old, what wisdom our kids have, right? The wisdom that they have. They know we need to be clear in our why. Okay, next slide. So the next strategy, and I just want to do a quick time check. I think I have like 10 minutes left or something. Okay. I think I'm almost there. I think we're going to be good. So the next strategy that I want to highlight is to pay attention to who your transformation champions are. These are the people who are already thinking about how things could be better. They're already in a space of being innovative. They are going to bring a diverse perspective into the room. And they're people who should be already active and engaged in their community. And so they can reach beyond what we like to say is the organizational walls. So as you are building people around you, one of my big things with everybody I work with is don't go alone. Don't go alone. And as you're recruiting people in, we need to be mindful that we're recruiting people who have different perspectives, different skill sets. Not everybody is a visionary, even though you like them. So that's what that affinity bias can lead you to. You can have a whole room of people who think just like you. And what you want to be able to do is be mindful of creating a really sort of intentional set of coalition partners. Okay, we're going to go to the next one. And then what you do with your coalition folks is you develop a vision together. And I would encourage you to use an appreciative approach for this. So again, this slide, somehow the things got a little bit moved around, but it does say to start off with is that you can use what we call a 5D or 4D process. And what we do is we discover together what is actually making a difference, what's helping us. We work to dream together on what could be possible. We talk about what should be, and we learn to improvise and move into what will be. I say that as if it's easy. And what can be easy here is to invite people to share stories related to these different pieces. And then the stories are what we then connect to. So there's a whole process that you can engage in, which is to be clear, to define what your focus is. We'll go to the next one. Last couple things, and it's not everything in terms of what we can and should be doing to lead with cultural intelligence. But one of the things that I think we tend to not do, which is to seek openings, what we tend to do is we tend to talk about the things that are most problematic. Okay, we tend to talk about only the things that seem that need to be fixed. And so what I want to encourage you to do is to think about what is an opening. Instead of trying to do work that's top down or bottom up, who are the people who are showing up right now? Maybe the change in your organization doesn't need to start with your human resources department. Maybe the change can start with some of the peer work. And can start in different places. So seek where the openings are, and then build your vision and by asking the question, what do we do well here? And so that helps things move forward. We'll go to the next slide. I always have to tell people this is a German slide. So as you are wondering why it is spelled this way, that is why. And what I want to highlight here is that as you are working to empower a broad base of people, you want to be intentional about being inclusive and invitational. So what I don't want you to do is to think that you have to have everybody in the room to get started. You got to start with your openings. And as long as you stay invitational, and this is like snowballing, it's like you build a little bit and you just keep going. So what does that actually look like when we talk about inclusion? That means that my very particular voice, like I tend to build things backwards instead of like in a linear direction. I like to begin with the end in mind and kind of go backwards, that is going to be welcomed in the room as well. And that we'll be able to build things from different perspectives. instead of being asked to assimilate or to have, some group of people go off. This is a thing I see a lot. There's a lot of co-location as if that is partnership. Anybody understand what that is? Where you like, okay, we have this program, and we have this program, we have this program, and this is an inclusive group, but they don't actually like work and share information together. So what I actually do is bring all of those pieces together. So that's important in this process. Okay, we'll go to the next slide. I don't have time to show this video, but we will, you can see the link of this. So what's important is showing up and celebrating those people who show up. So if you watch this TED Talk, what you're going to see is someone standing out and dancing, and then another person coming up and like starting to dance with them, and they're embraced. And then in 5 minutes, like this whole big crowd of people is all together. So when we think about starting a movement, what I also want to say is that you have to not only celebrate the people who show up, but you have to, really cultivate within yourself a sense of joy, a sense of meaning and purpose, so that you can be infectious on that end. One of the things that I see is that we show up because it's something we care about and we get really serious about it. And it kind of leads to burnout, right? It leads to burnout. So if you are looking to create sustainability, find ways to recognize the importance of naps, right? And of joy and of fun. Okay, next one. I could talk more about that, but it does lead to what I wanted to say, which is don't let up. That we need to practice and recognize resilience and vigilance. And one of the ways that you cannot let up is actually to take rest. It is not to say, well, I'm the only one who can do this. I think that, there are people who create nap pods. Those things are helpful. Encourage people to take breaks. Do not hold a meeting for an hour and not give people a break. Okay. Make sure you incorporate other ways in which there is either stretching or mindfulness or groundedness or something. And that is how you're going to keep things moving. Okay. So here we are. Last one is that we want to institutionalize the culture. And when I think about institutionalizing things, we've seen lots of examples of this being done badly. We could do it positively, right? In terms of how plaques and things get created, in terms of celebration. But the main thing is that we really need to just be intentional about it. And so what I like to encourage you to do is be thinking about that from the beginning. How are you going to be communicating your process along the way? Is that in a documentary? Invite someone to come alongside and be a documentarian in your process. Is that through art in some other kind of way? So be sure that you are intentional about institutionalizing this culture. I know I am right at the end of my time. So the next slide is what's resonating and questions, and I will try to take a few if I can. Maria, let me know what's best.
1 minute.
Okay.
This conversation is going to continue over the next
It
few
will,
days.
definitely.
So that's why, yes. But please go ahead. And if anybody shares what is resonating, I see amazing comments already. So
we'll definitely share slides. Is there, okay, I think someone has their hand up, so we can take that question.
yeah, Elsa, go ahead.
I just want to thank you. I have really been thinking about how am I going to help develop a committee to really be diverse and inclusive of, in my mind is have everybody come. But how you just described it really helped me see that that's really not possible, and take some and let them build as well. I don't have to do it alone. And I haven't been, but I kind of have been, so it hasn't been moving anywhere. And, so I greatly appreciate you sharing today. Thank you.
Absolutely. Thank you for that. Do not go alone. It's like my
I say, why reinvent the wheel, but yet I tend to always be reinventing the wheel for no reason. So thank you.
You're welcome. You're welcome. Well, I want to just encourage people. We try to continue to support all work in this direction. And there are lots of different resources that we share over time. We'll definitely get information out that I've touched on. Also happy in whatever way I can to be supportive. I think my website is being added to the chat. Thank you again for inviting me. I also I don't know if I said this, but one of the things that I think about is the intersectional nature of all of our work with different groups. And so like the Brian Stevenson's work. So I often ask people, have you read Just Mercy, right? It's just all of these pieces are helpful and important in that we don't have to reinvent the wheel, and that the resources are out there. And so the goal here, my goal is to help you be brave and create those connections with each other so that we can do this work. So thank you. Thank you, everyone.
Thank you, Dr. Dietra.
Yep.
Thank you so much. Of course, it's always so. And this is why we were very intentional. I want to capture a few things that you said, which is really what's behind the planning of the 3 days. So you talk about appreciative inquiry. So we're about to now hear 3 amazing examples of projects where all of these things have been put intentionally into really engaging community of colors. Because I think what you really said and what we are going to be talking for the next 3 days is that this is, again, we are all on this together. This is our mental health TTC intentional better together strategy. And therefore, we have the first, and I'm going to ask the speakers that are going to be joining us right now, because we're going to be hearing, first of all, and the importance of cultural responsive care in the field of early psychosis. As we know, this is really important in how we tailor those informations, how we include everybody, and how we come from an appreciative inquiry lens. Then you're going to be hearing about an amazing innovation, is the first Latine-led Lead Academy with lived experience is essential to this all. It's a way to engage Latino, Latina communities with lived experience recovery, and it works all the appreciative inquiry principles, and it works all of these issues that Dr. Dietra just talked to us about. And the last one, we are going to be hearing about native brilliance from one of our partners as well, because we also need to understand the needs of those of us, because I think as Dr. we always think about it is we celebrate you for being here, but who else are we missing here, right? It's for those of us for those people who are not on the table. And again, so this is such an amazing conference for the next 3 days. You will be hearing from our ATTC partners, PTTC partners tomorrow, and then a lot of the questions on the chat, we are taking note. We're going to be very intentionally in addressing those microaffirmations, microinterventions, and there's a whole presentation about the workplace. So without further ado, it is my honor to present the next presenters. Each presenter is going to do 15 minutes. Each of the teams are going to be only 15 minutes. We're going to be very strict with time because we want to make sure we make this 2 hours. We respect the time, and we start in time and end on time. So I am going to turn it over to our colleagues from Harvard, who are the partners of the New England Mental Health TTC. Dr. Raquel Meshlon-Gately. She is the Assistant Professor of Psychology at the Department of Psychiatry at Harvard Medical School. Lola Nedick, Clinical Research Coordinator of the Department of Psychiatry Medical School. And Joy Rodriguez, Clinical Research Assistant, also at the Harvard Department of Psychiatry. They are our partners in the team, and since the beginning of the New England Mental Health TTC 6 years ago, they've been advancing the work on early psychosis with multiple populations throughout the region. So Raquel?
Thank you so much, Maria. And first, I just want to say, like, wow, Dr. Dietra, that presentation was so helpful, important, and engaging, and I thank you so very much for that. Really, again, just phenomenal. So just quickly introduce myself, Raquel Meshalem-Gately. I am a psychologist from Beth Israel Deaconess Medical Center and Harvard Medical School in Boston, and our site's co-director for the New England MHTTC. So my co-presenters and I are delighted to be joining this very important conference. And in the next 15 minutes, my colleagues and I would like to briefly share an important series of initiatives we've launched through the New England MHTTC to address culturally competent care for people with serious mental health conditions. If you can go to the next slide. And actually one more. Thank you. So before we delve into more details about those initiatives, I just want to very quickly highlight some of our other work, which you can also get more information about through the QR code on the bottom of the slide. So while we've largely focused on early psychosis, many of our educational programs have taken a broad transdiagnostic perspective. The methods for our trainings have included webinars, online discussion groups, consultation lines, learning collaboratives, clinical briefs, networking and support, podcasts, conferences, a variety of website resources, and just surveying training and technical assistance needs. So as you could see on the slide, some topics have included mental health self-care for healthcare workers, and that was initially during the COVID pandemic, but then we extended beyond that time, coordinated specialty care, and that training was through a self-paced online course called Healthy Knowledge, and we're in the process of developing another one too, and psychopharmacology. So while we sought to address elements of culturally responsive care in all of this work, we felt it was important to provide more focused trainings through a separate series of initiatives. And as I know you're all very aware, cultural factors have a range of implications for mental health practice, including access to care, treatment-seeking patterns, lack of trust and stigma, the nature of the therapeutic relationship, and issues of racism and discrimination. And as a field, we're tasked with creating equal, culturally sensitive services for all. So to that end, I am delighted to introduce my co-presenters, Lola Nedich and Joey Rodriguez, to share more details about our initiatives to address barriers to cultural competency in mental health care. And I just want to say that Lola and Joey are project coordinators for our site, and they have just done phenomenal work for these initiatives, including spearheading a stellar ongoing podcast series. So with that, Lola and Joey, take it away.
Thank you so much for the introduction, Raquel. And next slide, please. So I'm just going to be talking about our culturally responsive care initiative goals for the project. So goal 1 was to support mental health care providers through their navigation of culturally responsive care through technology transfer. So we noticed that the providers we were interacting with had a particular interest in being more culturally responsive in their practice, but they sort of didn't know where to start or how to go about it. And we did notice that these sort of culturally responsive events had high attendance, so we sort of saw this need in our community and wanted to continue that work through the series. Goal 2 was to open up a dialogue between our team, providers, and individuals with lived experience to better understand the needs of our communities. So again, talking to local providers and seeing where they felt like there was gaps in their training and what we could help with. And we also didn't feel like we could accurately educate providers on cultural responsiveness without the input of individuals with lived experience. So we made a concerted effort to incorporate the input of those people with lived experience of psychosis into our products and our resources. Goal 3 is to enhance the accessibility of resources by using varying formats in order to reach a wider audience of providers. So, as you know, providers are very busy. We wanted to make several different ways for providers to learn about cultural responsiveness through multiple methods. And to do this, we have a webinar series. Webinars are typically recorded and posted to the website along with the slides so that providers can do self-guided learning as well. We also have podcast episodes and clinical briefs. So in whatever way you want to learn, we have tried to find a way to accommodate that. Next slide, please. And you'll notice that on the bottom right corner of each slide, there's a QR code that will take you to a link tree that includes all of the resources that we're going to be talking about today, as well as our whole culturally responsive care series. So this slide summarizes how we're working to achieve those goals that I just talked about. I talked briefly about making these resources accessible. So to do that, we had 3 formats: webinars, clinical briefs, and podcasts. They all address the topics of cultural diversity in the context of early psychosis in one way or another. And though this series is focused on early psychosis, it really broadly applies to any sort of mental health conditions. Some of the specific topics that we wanted to address through this initiative was specific strategies and tools that clinicians can use. Again, cultural responsiveness is something that appears quite nebulous to a lot of providers. It's talked about a lot, but mental health care workers aren't always sure how to properly educate themselves on it or don't feel trained through graduate school. So we wanted to keep providers updated on the sort of tools and resources that currently exist and when and how to use them. Another one of our goals was to address the challenges in diagnosis across cultures. And lastly, because we know that mental health stigma differs greatly across cultures, we wanted to try and tackle that stigma through this initiative. And that's a summary of our sort of specific strategies that we're using for this series. And I'll pass on to Joey for the next slide.
Thanks, Lola. As a part of our initiative, we, as Lola mentioned, released a culturally responsive care webinar series aimed at helping mental health care providers addressing cultural barriers in care through live webinars and recordings that are accessible through the QR code at the bottom right of the screen. And if you could go to the next slide, because I'm being mindful of the time. So, as a strategy to service the site's goal that Lola mentioned, to support mental health care providers through their navigation of culturally responsive care and enhance the accessibility of resources pertaining to culturally responsive care, our site created a clinical brief intended to introduce mental health care providers to the current understanding of culturally responsive care in early psychosis by providing an overview of culturally responsive tools and models, highlighting the need for the continued development of a culturally responsive care model with an emphasis on individuals who are experiencing early psychosis, because that is our site's specialty. Now, this clinical brief was curated by the Harvard site's review of the current literature on culturally responsive care in tandem with interviews among various mental health providers within our regional network. In these interviews, we asked questions regarding the real-world implementation of culturally responsive tools, such as the cultural formulation interview, as well as culturally responsive principles, such as cultural competency, provider positionality, and maintaining and holding an anti-oppressive and anti-racist practice throughout care. Fast forwarding to more of the present, to service the site's goal of opening a dialogue between our team, providers, and individuals with lived experience to better understand the needs of our communities. The Harvard site had the very fortunate opportunity to platform perspectives from seasoned providers actively working on themselves and their community while integrating that work into their practice, which is a huge feat, on C4 Innovations Changing the Conversation podcast. And we did so in the form of a series of 5 episodes, all under the umbrella of culturally responsive care. Lola Nedich and I, as individuals just getting their feet wet in this field, had candid conversations about culturally responsive care as a lifelong process. covering important themes like making space for what you don't know and what it means to value the practice of building relationships with other people that are different than you. You could go to the next slide, please. So as for moving from what our current initiatives have been to what is next for our site, we are continuing to connect and build partnerships with communities local to our region in Massachusetts through community behavioral health centers, which are nested in every Commonwealth in Massachusetts. In this partnership initiative, we are kickstarting another webinar series that's geared towards clinicians working in outpatient settings with clients who present with a variety of mental health conditions, including serious mental health conditions. And this series will answer some common questions about working with individuals who experience psychosis and their families, including role plays and or case discussions of common challenges. And we're really proud to say that we're able to integrate perspectives of people who have practiced in the field, people who are just beginning in the field in this initiative with CBHCs in Massachusetts. Additionally, Lola, feel free to hop in when I say we are also kind of excited to announce that C4 Innovations has given us the really fortunate opportunity to do another season of culturally responsive care on their platform, Changing the Conversations. And we are going to be covering two topics right now, language and psychosis, as well as what metrics there currently are to be evaluating what it means to be providing culturally responsive care. And also, this is an opportunity if anyone is really excited about culturally responsive care and really interested in having specific themes covered, we'd be more than happy to try and cover them if you're willing to put your thoughts in the chat or email either Lola and I individually. If there is something really important to you that you'd want to have platformed in this series, we'd be more than happy to try our best to cover this.
Thank you so much, Joey, for talking about the podcast. And yeah, definitely please put some ideas in the chat. We're always open to input, and we really want to listen to what providers need when we're putting together these episodes. And the last thing is that we are continuing our work on social determinants of health. So like Raquel said, social and cultural factors can have a huge impact on mental health and physical health outcomes. So we really want to incorporate that more in our work. To do that, we're in partnership with the Global Research Network on Social Determinants of Mental Health. We're actually having an event with them this week. And we're also working on a clinical brief about social determinants of health to make that information more accessible for clinicians. Next slide, please. So this slide summarizes our upcoming webinars. So this week we have our Social Determinants of Mental Health and Exposomics webinar calendar. If you scan on the QR code, on May 28th, we have Incorporating Cultural Considerations in Outpatient Care, which is part of the Community Behavioral Health Center series that Joey was talking about. On May 24th, we have Integrating Peers into Coordinated Specialty Care Teams. And on May 29th, we have an event on workforce development and early psychosis. And that about sums up our slides and our upcoming events and our goals. I think we have a few minutes left, so if anyone has any questions or comments, I think we have some time for those.
Well, Lola, I saw a great about podcasts in other languages, and that's what we're here to do. So please really feel free to reach out if you feel like that. We definitely do a lot of things in Spanish and Portuguese. So, but we are always open for that, and I know Lola and Joy have done an amazing job with this in collaboration with C4. So we will be delighted. That's what the TTCs exist for, and I know others do as well. So yes. So great. Well, thank you so much for your information. As they said, everything is available on our website, and you have access to all of these resources. So we invite you to visit it. And we appreciate it sticking with the time. And it is a pleasure to be learning from you all. So now it is, let me introduce the next presenters to talk about the Latine Lead Academy. Christine, it is my honor. Well, Christine and I work together. Christine Irisiari, as she said, she is the manager of the New England Mental Health TTC, but I also had the honor to meet Christine back when she entered the Lead Academy. So she's a graduate of the Lead Academy that you will be learning a little bit about today. And Jamilet Rodriguez is in the current cohort, which is one of our initiatives this year. So without further ado, Christine and Jamilet, bienvenidas.
Thank you, Maria, for having us. And thank you all for joining. It's been a pleasure to coordinate this event. And I'm so excited to be able to share a little bit about me and about Let's Lead. I'm going to start with Let's Lead, and then I'll formally introduce myself, and then I'll share with Jamilet. So next slide. So Let's Lead is a lived experience transformational leadership academy, and it's hosted by Yale Program for Recovery and Community Health. And next slide. And a little bit about the program. And again, this is just a really brief overview. At the end of the slides, there'll be a QR code that you can grab and then learn more about the program. And this is just a brief overview because of time. So some of the goals of the Let's Lead Academy is to understand critical and emerging issues in mental health care. It's to learn and practice key elements of transformational leadership. And us as fellows, we are able to develop an amazing project to support our communities, mental health, and any other lived experience things that people might have gone through. So next slide. So the program is a 9-month program. We do 11 weeks of virtual classes. It's 2-hour sessions each week. The education components, we do group discussions, we practice leadership skills, we have presenters, we're fortunate that Dr. Dietra is one of our presenters, and we have amazing other presenters that come in. And then we do we have a mentorship project or a mentorship opportunity where our fellows will always have someone from Yale to kind of share, talk to, support, and then they'll have external mentors that would support with their projects. Once the 11 weeks are done, then fellows meet once a month and continue to develop their project, continue to link with communities. With their communities, we have mentors from all over the states and outside, international, and from here we have, Jamilet will share a little bit more about where she's from and how she got here. And then we do a graduation. Next slide. So now I will talk a little bit about me and how, I got here. So next slide. My name is Christina Rosari, and I am right now the MHTTC education manager, and I was able and fortunate to kind of coordinate some of this Better Together conference. But before I got here and before I entered the Let's Lead, I worked in mental health for over 13 years, and I would support young adults. And when I got into the program, I realized that there were so many things that I had not kind of shared out in the community about myself. So next slide, Lee. And when I think about myself, right, one thing that all these pictures have in common is the layers of who I am. And in the past, I used to hide so many layers because, you know, of shame and guilt and all these different things. And one of the things that I've learned from the Let's Lead program is that sometimes we can come with all these layers and we can share who we are without shame. And it's okay. It's okay because we have other people on the other side that might be dealing with similar situations, and we just have to learn how to share those and be in a space where you feel safe. And like Dr. Dietra says, brave spaces, right? So I try to always have that my presence in a space gives people the opportunity to be brave and share about themselves. So that's a little bit about me. I have 3 children. I work full-time. I just graduated yesterday from my master's in business administration. So I'm very happy and very excited that this actual academy gave me the opportunity to self-reflect on myself, and also gave me the opportunity to share what peer support was within my agency at that time. Next slide. So a little bit of my journey and my experience in the academy was the mentorship. The mentorship that they provided was amazing. It was incredible. I could not have done my project. My project led to be some, you know, kind of supporting my agency and understanding what peer support meant. And honestly, the guidance was amazing. The curriculum covered so many topics that helped me kind of reflect, like healing racism, culture of humility, comprehensive approach on leadership, and then the emphasis on courageous conversations. I think as we go in life, right, we always need that push of learning courageous conversations. And I think that was something that this academy supported me in learning. So enough of me. I want to pass it on to Jamilet. And she has been an amazing Latina Let's Lead fellow. And as a Latina, I would say myself, some of these self-reflections weren't as easy as we think. So I am happy that I've been able to meet Jamilet, and she has helped me in my learning journey and as the coordinator of this event. So Jamilet, I pass it on to you.
Well, good afternoon. Thanks, Christine. Good afternoon. Thank you for having me. I am Jamilet Rodriguez. I am a Latine Let's Lead fellow. Next slide, please. I identify as I'm Afro-Latina, Afro-Caribbean, Puerto Rican, living in the archipelago of Puerto Rico, which is actually a colony of the USA. I am a Black lesbian, mother, partner, person with lived experience, Latina, and Puerto Rican leader. Next slide, please. Well, before the Latina Let's Lead, I have 20 years of experience working with mental health and drug courts in Puerto Rico. And as Christine says, we have many layers that we hide because of shame and guilt and any other things, especially when we live in Puerto Rico with all the colonialism issue. So fellowship gave me purpose and hope, strategies to the conversation, the uncomfortable conversation that we need to have. We've been talking a lot in the classes about intersectionality, racism, classism, racial and historical trauma, and we kind of understood that talking about all this stuff is a way of healing. Next slide, please. For my journey, what is important is I want to promote recovery, healing, equity, because we still dehumanizing people for the background, the skin, their color, and all the layers. So I think we all need more representations in all these spaces as Latino, as Black people, are people with lived experience, and we need more of that for we're still fighting for equity and social justice. Next slide, please. I am still in the journey of my fellowship. I think I am in half my way, but for me, it's been experience of amazing experience, knowing all person, knowing Christine and Maria and all the mentors that we have, and understand and acknowledge many things that helps us know about how to be better leaders. So I hope to, at the end of my fellowship and a beginning of my journey, I could have clear goals about my future. I still want to learn about equity and social justice, to still fighting in Puerto Rico, because we really need to bring to table meaning conversation, to create brave space for people to begin to talk about healing, not only recovery, just include healing, restoration, and liberation, because the guy in the photo is my son, who is neurodivergent and has a spina bifida, and I think he deserves a better future, and that's why I want to be a better leader in this journey. Thank you.
Thank you so much, Jamilet. We have a couple minutes for questions about Let's Lead, or any other questions you might have. I think Let's Lead is an amazing opportunity. We'll be having more opportunities on Let's Lead. Here is a QR code that you can actually scan, and it will take you to the Yale Let's Lead page. Again, it's a great opportunity. We will be sharing some of when our next Let's Lead classes, our cohorts are happening. I know we are extending, and we have great news. We will have a Let's Lead Academy in Iceland, and another one in Canada. So we are very, very, very excited about how all that's happening and how it's expanding around the world. Maria, I don't know if you want to share anything else about the Let's Lead. I know you've been one of the pioneers for this initiative.
Thank you, Christine. And I think this is a great opportunity for us to really ask questions and check in with everybody on the conference. Yes, this is it's been my honor to be working around this effort for the last, oh my God, since 2017 with Dr. Shirelle Bellamy. And as a woman in long-term recovery, this has been really a great opportunity for me to do my voice, to really get to connect and understand that we are people first, no matter what the diagnosis is, no matter where we are coming from. This is a way for us to really embrace who we are and be able to lead. And I think what's important about this is really based on the healing and the journey of all individuals, of all communities of color. Is a very way, because I think the way that we want to be able to engage other communities is by having people that represent us and have a voice, so we can then bring other people. So this concept of transformational leadership, appreciative inquiry, and all of these other concepts are really, really important. So let's see if the audience have some questions. I think I see Christina sending us a big message here for Latino communities. I want to know, Joy, I mean, everybody is sending different messages. So I'm gonna open it up. If you wanna raise your hand, please, so we can call you up for the conversation. I cannot see the hands up, but I know others can do that, so.
We've got a question coming in the chat from Ermelinda that says, in Puerto Rico, are we seeing a recognition of the indigenous culture? And I was just opening that up for folks who might have an answer.
Yes, unfortunately, we haven't. We are beginning to having recognition of the color people of the Afro community. So we are very, very, very far to talk about indigenous community.
Thank you, Jamile. We have another kind of maybe comment for Joey, and it's from Christina. I will be launching a podcast in Spanish. Cultivando Raíces Saludables. This is it's in the planning stages. So this is kind of more for Joey and Lola. So thank you for sharing that, Christina. We, share the link at some point and we will share it along. Any additional questions, maybe from the Harvard team or Let's Lead?
Okay. Well, so I think for the next session, we may be ending. If there are no questions, I want to make sure just to kind of summarize a little bit what we've been talking today. We will be putting on the chat all the information on the Native American Brilliance series that the New England Mental Health TTC has running on for your information. So we're gonna be actually today ending a bit earlier, but I wanted to just make a few points in terms of why this conference came together and what we were seeking with the partners. As I mentioned before, this is a partnership between the ATTC, the New England and the PTTC and the ATTC. All these TTCs are funded by SAMHSA, if you are not familiar with this. So what it is important is we are here to provide free training and technical assistance in the region and around the country. But equity-minded approaches are very essentially for our work. So today you heard the foundation of Dr. Dietra in terms of appreciative inquiry, in terms of how we approach this and how we access. So on Wednesday, you're going to have the opportunity to continue that conversation, and as well as tomorrow, where you are going to be presenting with different approaches and different models that have been working well. We're going to be hearing about an amazing toolkit that was developed by the C4 partners in terms of work inclusion, and also a new curriculum that encompasses all these aspects. So I'm going to turn it over now to Dr. Janice Tandora, who is going to be closing the conference for us and doing some closing remarks in behind of the New England Mental Health.
Thank you. Thanks, Maria. Well, good afternoon, everyone. I just have a couple of minutes. I just want to make sure that I use this time really to express our gratitude for the many individuals and partners that come together to make this annual innovations conference possible. And first and foremost, there really is a tremendous amount of work that goes into organizing a multi-day virtual event like innovations. So a huge shout out, to our entire New England MHTTC team, many of whom you heard from today, but especially to you, Christine Irizarry. You've been juggling behind the scenes for weeks to make sure that we were ready to go. And if you didn't see my note in the chat, we are so very, very thankful that Let's Lead brought you to the New England MHTTC team. So thank you. Dr. Dietra, it is always a pleasure to have you. Thank you so much for kicking us off in a powerful way and really setting the tone for all 3 days of our conference. We're, particularly proud of the equity-oriented focus that we embed, not just in our processes, but across all of our projects. And it was really wonderful to have the opportunity to share just a couple of those with you today. Our culturally responsive care initiatives, our Latine, Let's Lead, And as Maria just alluded to, we're really proud of our regional partnerships that we've established with our addiction and prevention technology, TTC transfer partners. And so please do come on back and join us tomorrow. Their work is going to be featured on day 2. And lastly, I would, just say, of course, our appreciation goes out to SAMHSA, not just for the funding of the New England MHTTC that makes this innovations event possible, but really for showing up and for joining us, for welcoming remarks to share a bit about how our conference theme fits into SAMHSA's overall mission. And then finally, thanks really to all of you for being with us here today and just for your commitment to working together to better engage communities of color. So